3.5 years ago or so, when we started deploying IMO, I mean, it took us some time to understand the thresholds, first of all. And the normalized engine has evolved a lot over the period of 3-4 years for us. So when we started initially, we looked at labs because that was far more complicated. So what we did is we had in-house informaticists who actually pulled in all the codes and results from IMO and these equivalent thresholds. And we went through one by one. Actually, this is an exercise that we've done because when we actually produce these metrics and we set the thresholds, it's very critical for us on a clinical data level, right? So for us to get to that level of accuracy, what we did is our cohort was close to 60,000 rows of sort. So we had a full 3-4 weeks of exercise in which clinicians from our team, informaticists from our team, and data analysts, we went through this exercise of looking at how do we actually fix this threshold meaningfully. And IMO has a default suggestion as well, right? So any score between 0.98 to 1 is almost an automatic match. And we were basically validating that. So we were trying to validate if that sits true with all our different sources. At that time, we had 3 domains by IMO's engine, which was problems, procedures, and medications. So we picked specifically lab codes in this, and then we went through that exercise. That put us in a way where we were very comfortable in setting the thresholds on anything 0.8, 0.98 and above. So in simpler terms, anytime we have something between 0.8 or to 0.98, it's close enough but there needs to be a human intervention. And then anytime it's 0.98 and above, it was comfortable for us to actually get to the point of an auto match. So and that was our threshold logic to start with. Then we had to fine tune with our lab data. We worked with IMO multiple times and, refine the thresholds, and each domain is very specific, right? So the recent improvements on auto domain matching and the thresholds vary on that. Sometimes you specify the domain, you get higher threshold matches versus you don't specify, it just creates an ambiguous response. So trial and error initially to the point of standardized procedures are operating, which led to us define those thresholds of 0.98 to a certain extent. And 3.5 years ago was at a different level of maturity, but it is performing at a decent level today. So that's another work in progress on how we are actually evolving towards setting up the thresholds. But that's the exercise that we had to do internally from our side to validate these scores for getting into a confidence at the match level.